to this special edition of the Dr. Nemeth Radio Show. I'm your host, Anne-Marie Cronin, here tonight talking with Dr. Nemeth, board-certified periodontist in Southfield, Michigan. Dr. Nemeth is with us discussing his state-of-the-art clinic, latest treatments in periodontic care, and the relationship between gum disease and many systemic diseases, from cardiac issues to cancer. Now, for the listeners out listening to the show for the first time, or if you've heard Dr. Nemeth before, you know that he is giving us very important information about the link between periodontal disease and many systemic disorders. We were talking about Alzheimer's disease. We're going to move on and let's look at this list and see some of the other diseases that are affected by your oral health: diabetes, cardiovascular disease, liver cancer, lung cancer, pancreatic cancer, low birth weight children, rheumatoid arthritis. Dr. Nemeth, tell us about some of these diseases and the links between these diseases.
Well, a very prevalent disease is diabetes.
Right.
And there was just a study, in fact, I just read the study yesterday, but I've known this for a long time. Diabetes is very strongly linked to periodontal disease. If you have diabetes, you're likely to have more severe periodontal disease. If you have periodontal disease, it's likely to affect your diabetes or maybe even initiate it or cause it in some cases. Because what happens is when you have periodontal disease, that means you have an infection in your mouth. Now that infection isn't just in your mouth. These organisms, these bacteria, these parasites from your mouth, from this gum disease, get into your bloodstream. They cause what's called a generalized inflammatory response throughout your whole body. And these parasites, amoebas, trichomonads, spirochetes, many of them, they get into your bloodstream, they cause this inflammatory response, and they land on different organs and throughout your body. And we find that in almost every diabetic patient, this is fascinating, in almost every diabetic patient, when we treat their periodontal disease, their blood sugar goes down, their A1C goes down, their diabetes becomes easier to control. Virtually every single diabetic that I've ever treated, we have had them tell us that their blood sugar has improved and their diabetes is easier to manage. I had one patient who had a A1C, you may not know what that is, but it's some kind of a long-term measurement of blood sugar. Her A1C was 14 and it dropped to 8 after treatment, which is still a bit high, but not anywhere near 14, which is terribly, terribly dangerous. So we know that we can clean up that infection, because that infection affects the entire body, particularly diabetics. We can always get their blood sugar and A1C better by eliminating the gum infection that most of them don't even know that they have, because gum disease usually causes no pain. There are very few signs. Most patients are referred to me by their dentist because it's their dentist who detects the problem, and the patient has no pain. They don't know anything's going on. By the time a patient is aware of it, it's usually so advanced that teeth are loose, have been shifting, and often have to be removed. So diabetes and periodontal disease are very, very strongly linked. Cardiovascular disease, all cardiovascular diseases, heart attacks, stroke, they're all linked to periodontal disease, again, because, and they find these organisms in the plaque of people who've had heart attacks. So we know that these organisms are getting into the bloodstream and they're contributing to plaque formation in blood vessels that can lead to heart attack and stroke. Very strong link, very, very strong link. Very much high percentage of people have cardiovascular, heart, stroke problems if they have periodontal disease. Let's talk a little bit about liver cancer. Recently there was a study in England indicating, and I did a video on this actually, indicating there was a 70% increased risk of liver cancer. 70% increased risk of liver cancer in people with periodontal disease or gum disease. it affects every part of your body. These organisms affect everything, and they're devastatingly bad.
Are there some people that get these organisms? Is this a genetic thing? That's, a very interesting factor.
Well, it's really interesting. Well, some people have a genetic predisposition to being susceptible to these organisms. So some people have these organisms, but for some reason they're resistant to them, and they don't cause the bone destruction that they might cause in other individuals. So there's a genetic component, but it's not all genetic. We do ask all of our patients, did your mother have gum disease? Did your mother lose teeth? Did your father lose teeth? What about your grandparents? And in many cases, of course, they did lose teeth. But it's not all genetic, it's only part of it. If you keep your mouth immaculately clean, and if you eliminate these organisms, even if you're genetically predisposed, it doesn't mean you're going to lose your teeth. It doesn't mean you're going to get periodontal disease. But if you're genetically predisposed, then you're much more likely to have periodontal disease than somebody who's not genetically predisposed. So there is a genetic component, but it's not by far the only thing that makes or breaks someone as far as periodontal disease is concerned.
So with diabetes, if somebody already is a diabetic and they're already on medication,
We make them better.
oh my gosh, that's
We
unbelievable.
absolutely make them better. In many cases, they can reduce that medication. There's been a few cases where they've been able to discontinue it completely. But virtually in every case, there'll be an improvement in their blood sugar, there'll be an improvement in their A1C, and it's just so gratifying. I mean, this is why I love what I do. I can make an impact. I'm able to make an impact in the lives of people in a way that they can be healthier, they can feel better. It's just incredibly gratifying to help these people be happier and healthier and live longer. It's really why I love, one of the reasons, especially now, why I love what I do, because I can help people in ways that we never knew about before.
How does the general public find out about this, though? Most people go to their doctor, they get diagnosed with an issue, a disease, they have cardiac problems, and then they're going to see a cardiologist or a specialist. But how do you get the word out and let people know that they really need to come in and have a thorough profile examination on what's going on in their oral health?
I talk to people like Anne-Marie.
Okay.
Really, this is how you get the word out.
Right.
People do not know about it. I do videos. I have many videos on various aspects of periodontal disease and how they can affect people. We put a newsletter out. We have almost 24,000 YouTube followers that follow me, because I try to make this interesting. I try to make it interesting for people, so that they will want to find out more about what's going on in their mouths. But the word is not out well enough, because again, people just don't know that they have the problem unless their dentist finds it, or unless they somehow, their gums are bleeding, or their teeth are shifting, or their teeth are getting loose. Then they may know it. But very often there's no signs. I've seen people whose mouth looks perfect, their gums look perfect, but there's almost no bone. The bone has been almost all destroyed, and those teeth are ready to fall out.
So the thing is that people really need to come in and have a thorough examination with you.
They need to get in and have a thorough examination with their dentist, or they can call directly. But they need to see someone who will double check for periodontal disease. And I'll tell you a little bit more about what goes on with periodontal disease, how it progresses, and why a lot of these patients are not diagnosed in time.
Well, it's certainly a very interesting connection, but we're going to have to take a quick break. In the meantime, you're listening to the Dr. Nemeth radio show. You can reach Dr. Nemeth by calling 248-357-3100. Again, that number is 248-357-3100, or by visiting him on the web at drnemeth.com. That's drnemeth.com. You're listening to the Dr. Nemeth radio show on News Talk 760 WJR. Too sharp.
Just a little bit, it's
Mm.
okay.
It's okay.
If you haven't heard 30 yet, when you start your close, just slow down.
No, I just didn't want to go on another, because it was too hot of a
Yeah,
topic,
that's
another
okay.
question. Anything that you're thinking about?
I mean, it's all really interesting. I mean,
It is.
I think it's really hard to find out about it. I mean, I read a ton of like nutrition bloggers and things like that, and I mean, that's how I learned a little bit about it, like scraping your tongue for the bacteria in the morning so you don't swallow it. But I mean, I don't know, a lot of people don't understand the connection between
Did
your
you
mouth
maybe,
and everything else.
did you maybe want to mention how we could do slide checks for people if they're
I'm
curious?
definitely going to mention
Okay,
that.
okay.
Yeah. Doing what?
We take a sample from under their gum to look and see if they have periodontal disease, to look and see if they have these parasites and bacteria that cause infection. We look at that under the microscope, we put it on a large TV screen, so the patient and I can look together and see what, if anything, is going on there. And we can see those organisms. If those organisms are present, amoeba, spirochetes, trichomonads, and others, and we can see them, we know that patient is diseased, and the patient realizes they're diseased. And because they don't feel anything, they don't know anything's going on, but when I show them their slide and these parasites moving around in their mouth, it's a rather unforgettable scene for them. It makes a huge impact, and it needs to, because most people don't have pain and don't know anything's going on.
I'm thinking everybody should go and see you.
Everybody should go and see somebody to check their mouths. The problem is, if a patient is going to their dentist on a regular basis, periodontal disease, you see, progresses very, very slowly. It's like watching a child grow up. If you see a child every day or every week, you're not gonna notice a change. That child isn't gonna look much different to you because it happens so slowly. And very often, the same thing happens when the patient goes to their dentist. They see the dentist regularly, yeah, they've got some gum pockets, they've got a little bit of inflammation, but it's not that much worse than last time. And so it's not, it doesn't jump out at them like they should. Very often, patients come to me when they're seeing a new dentist for the first time, and that new dentist all of a sudden sees, oh, wow, you really need to see a periodontist. And those are the patients that often come to me. Sometimes they come from the regular dentist, but very often there's come from seeing a new dentist who sees what's going on, where the other dentist has just sort of grown used to the situation and hasn't noticed a change from one appointment to the next, because it usually isn't that dramatic.
So it's possible then that a patient has has the bacteria in their mouth, but they're not showing gum disease, right?
That's very possible. In fact,
I want to talk about
the
that.
statistics are 50% of adults have gum disease and 70% of adults over 65 have gum disease. Those are the official statistics. I believe it's much, much higher than that, because periodontal disease starts when you're very young, but it doesn't.
Right.
But it takes a long time before bone loss shows up and before the teeth start shifting and moving. So very often it's not recognized in the early stages because you don't see the consequences in the early stages, but that's when it really needs to be caught. The earlier it's caught, the younger you are when you treat it, the easier it is to treat, and the better the long-term result is, because it has caused less damage to the bone than catching it in the later stages.
Right.
So what we do when a patient comes into the office, we take a sample from under their gum, as I was telling you. We look at it under a microscope. Every patient, we look at that slide to see what's going on. And we see parasites.
My God.
Yeah, we're showing some of what we see. And as I said,
Oh my God.
if you have these things in your mouth, and most people do and don't know it, you are going to remember it. No,
Okay, I
here's
wanna
the-
talk
here's
about
the-
this.
Let me just mention one other thing.
We're gonna talk about it at the radio, okay?
Sit.
Thank you for that. He's just gonna. That's good. That's what I was gonna say.
Save the passion, I love your enthusiasm.
Yeah, right?
No, I mean
I
it's
said,
amazing.
save
You're.
the passion, I love your enthusiasm right now, it sounds great.
Yeah, you sound really good.
It's fabulous. But I'm gonna start. Okay, can we start? Because I really want to ask
Go
this
ahead.
question.
Yeah.
Welcome back to the special edition of the Dr. Nemeth Radio Show. I'm your host, Anne-Marie Cronin, here tonight talking with Dr. Nemeth, board-certified periodontist in Southfield, Michigan. Dr. Nemeth is with us discussing his state-of-the-art clinic, latest treatments in periodontic care, and the relationship between gum disease and many systemic diseases, from cardiac issues to cancer. Dr. Nemeth, over the break, I was just blown away by some of the things you were telling us about how almost everyone could have the manifestations of this periodontal disease at a very young age, but it's getting missed. They need to come in and see you early. And I'm thinking to myself, a lot of people think if they go to their dentist and they use a mouthwash every day, the mouthwash is going to kill any bacteria, but that's just not true.
It's true if the bacteria are superficial, but what happens is these bacteria, parasites, get under the gum. And once they get under the gum, they're able to multiply, breed, fester, shall we call it, and cause this infection. And once they get under the gum, causing the infection, it causes that gum to separate from the tooth. It's called a pocket. The pocket gets deeper, more organisms get into the pocket, causing more infection, and becomes a vicious cycle. And mouthwashes can't get into those areas. They're just not accessible to it. Yeah, if the bacteria are easily reached on your teeth or perhaps on your tongue, but yes, but if they're in these little pockets under the gum, most mouthwashes do not reach those areas adequately enough to destroy or kill these causative organisms.
So my question to you is, as most people will go to their regular dentist on a regular basis, whether it's quarterly or twice a year or how often they go, it's quite possible then that the dentist you're going to is going to miss the early stages. In other words, the bacteria is there before there's a manifestation of it and before they would refer over to you. Is that right?
Very often that's the case. Very often they may say, well, the gums are bleeding, let's clean your teeth and we'll watch it. We'll watch it, we'll watch it, we'll watch it. Well, sometimes that's okay, but very often they just watch it get worse and worse and worse, slowly. And by the time the patient and or the dentist realizes it's reached a really serious point and the patient gets to me one way or another, a lot of damage may already have occurred. Let me mention one other systemic disease that's very, very important and a lot in the news lately, and that's pancreatic cancer. Harvard came out with a study last year saying, at least in men, I think it's true for women as well, that there was a 59% increase in the risk of pancreatic cancer if you have periodontal disease. I'm talking pancreatic cancer, I'm talking 59% increased risk. I can't think of many cancers that are more devastatingly fatal.
Oh yeah,
than
it's lethal.
pancreatic cancer.
Yeah,
So the people need to get their mouths checked. People need to have a sample of their bacteria under the gum, or they can take a test that's sent in for a DNA test, which will also show the levels of bacteria. But we like to make it graphic and actually show the patient what's going on. Sometimes there isn't much bone loss at all. Well, that's interesting. So let's say these people are resistant to the effects of periodontal disease. They don't have bone loss. Their teeth are solid. There's no bone loss. But they have the organisms. The bacteria are there. They're not causing the damage to their mouth, but the bacteria are still getting into their bloodstream. So those people are still at risk because the bacteria, the parasites are there. They're resistant to the bone loss, but they're not resistant to the systemic effects of these pathogenic organisms. So I'm telling you, to me, it's rare that somebody comes into the office, or even the general population, if we took a sample from under their gum, we wouldn't find some of these organisms. So some patients say to me sometimes, well, is this normal? And I'll say, yes, it's normal, but it's terribly unhealthy. Why is it normal? Because so many people have it. So it's normal, but it's far from healthy.
Right, and I know that, during the break, one of the gals from your office was showing us an actual video of what it looks like. So when patients come in and you do this test, they're actually able to look and see what's in their mouth.
Absolutely. You know, there's a very well-known internist at Cleveland Clinic, and he has said that if you have an unhealthy mouth, and to me that's periodontal disease, it can take 6 to 7 years off of your normal lifespan.
That's
And
unbelievable.
it doesn't surprise me one bit at all, considering all of the systemic diseases that this is linked to, and in my opinion, contributes to.
Now, with all these horrific diseases, and certainly pancreatic cancer is more or less a death sentence because there's no cure for it. I mean, it's a horrifying disease, and certainly the other ones, Alzheimer's and liver cancer, lung cancer, they're all horrific diseases. But my question is, when did all this research start surfacing? I mean,
It's gradually been surfacing over the last 20 years, really, maybe even longer. Heart disease was one of the first things. Low birth rate children. If you're pregnant and you have gum disease, you're more likely to have low birth weight children, and low birth weight children tend to be less healthy initially and even long term. So those findings came out fairly early. More and more, and diabetes was linked fairly early, but we didn't really realize how strongly linked they were until more and more research has been done. The studies about liver cancer, well, that's more recent. Alzheimer's disease, that link and maybe causative factor, much more recent.
right.
Liver cancer, much more recent. And they're finding new things every day. Rheumatoid arthritis is now associated with periodontal disease. I can think of almost no part of your body, almost no organ, almost no systemic disease, cancer, cardiovascular disease, every part of your body, in my opinion, is affected in a negative way if you have infection in your mouth, because it ain't just in your mouth. No, it goes throughout your body and affects everything.
So, I mean, what I'm hearing here is that everybody should actually be going to see a periodontist and to be tested because you have nothing to lose and everything to gain.
Unfortunately, most periodontists that I know of do not actually take a sample from under the gum and look at it under a microscope. I know many who do. A very close friend of mine in Florida does the same thing, and I know a few others, but most of the time that is not done. Almost every patient that's come to me who've seen periodontists before say, well, this was never done to me before. There was a periodontist who retired not too long ago, and I have a number of his patients, and they were long-term patients and they were very satisfied. But the patient yesterday said to me, the best thing that ever happened to me was when blank blank retired and I came to your office, because there were all kinds of things going on that had never really received attention, unfortunately. And I think it's very important to see if the disease really exists and to take a sample or a slide to show the organisms that are associated with it and let the patient see it. And that, for the most part, is rarely done whether you're in a general dental office and even a periodontal office.
Well, that's good news for us that you have that capability and that you're doing it, because Florida's too far away to go to the other periodontists. So you're here and you're doing these tests. We want to also talk about what the treatment is, and how you then start treating the patient that you've identified these microorganisms in their mouth.
I want to talk a lot about the treatment because a lot of people are afraid to go to the dentist. They just have an innate fear of that. Well, a patient comes to our office, by the time they leave, well, they're certainly not afraid of our office anymore, and many of them have lost their fear of dentistry, because we make sure what we do is pain-free and those patients are comfortable, and I'll talk more about that in just a minute or two.
Okay, we'll talk about the treatment approaches after the break. In the meantime, you're listening to the Dr. Nemeth radio show. You can reach Dr. Nemeth by calling 248-357-3100. Again, that number is 248-357-3100, or by visiting him on the web at drnemeth.com. That's drnemeth.com. You're listening to the Dr. Nemeth radio show on News Talk 760 WJR.
That was
How did it sound,
killer.
ladies?
That was really, really good. Yeah.
Yeah, it sounded really good.
hmm
Anything that you're thinking about that we're missing since you're
Not
into all
easy,
this health
it's,
stuff?
Well, I mean, it's all super interesting. I'm just amazed.
I know. I'm amazed too. I was
It is
getting chills
amazing.
at
I
certain
didn't
moments.
realize that there was a paucity of periodontists that are doing the stuff that you're doing.
Almost not.
Almost none. Well, then it seems like just everybody should be just booking an appointment to go and see you, because what do they have to lose? I mean, don't you think that everybody should go? I mean, seriously.
I think everybody should have a slide or a sample of their bacteria taken to see what, if anything, is going on. Not in everybody do we find something. As I said, there are some people that we don't. These people are usually very meticulous about their mouth. They really keep their mouth clean and very healthy, and they are free of these parasites and pathogenic organisms. But I would say probably for most people, that's not the case.
Yeah, it's the common person on the street that doesn't know any better and just assumes that. I would think that most people are waiting until their dentist that tells them that they've got, gum recession or something before they're gonna refer you
Gum
out.
recession is another story, because gum recession is visible. You can see if you have gum recession.
Right.
The dentist can see. See, if it's visible, then you know it, and you're gonna be more likely to seek attention. So I treat a lot of gum recession. That is a form of periodontal disease, because if you're losing gum around the teeth because of recession, that means you're losing bone around the teeth. And when you lose bone, you have periodontal disease, because the bone supports the teeth. But typically, there are different causes at work or in force when it comes to gum recession than infectious periodontal disease. And let me talk a little bit about how we treat gum disease in the first place.
Okay, we're gonna start with that.
Oh,
No,
well,
Go ahead.
one other thing that's interesting, I don't know.
I mean, were we on a break?
Yeah.
Well, I don't know when we're on a break.
Didn't you hear me saying we're gonna have to take a quick break? You're
Yeah, but
listening.
you never, but meanwhile, that was not a quick break. I was running on like diarrhea from the mouth for what seemed like 10 minutes.
What?
Okay.
What's he saying? I wasn't listening to him.
No, he said
He
he was
said, he
recording
does
it.
record it, he's learned that
Yeah,
by
he-
now, he never stops the tape.
That's right, exactly.
Thank you.
No, he doesn't.
Oh, that's gold.
Right, exactly.
No, I was gonna ask, how are people being exposed to the bacteria? Is it from, like,
Right.
is there a pattern with, like, the
Yeah,
type of food
I
or
would say
diet?
probably 30 to 40% of my patients ask, well, how did I get these things?
Right.
These things come from many, many sources. You can't really avoid exposure. You can get them, they're transmissible. You can get them from kissing. You can get them from pets. Dogs tend to get periodontal disease at a very young age. In fact, 3 years, and if you're playing kissy-kissy with your dog, it's licking your face, it's not necessarily so good for your mouth. They may be in food that's exposed, they may be in the air, they could be in utensils. You're going to be exposed to these organisms. The important thing is in treating it, and we treat it with a laser. It's virtually painless. We treat it with a laser. We destroy these organisms. We shrink these pockets. And then what's really critical is we teach the patient how to take care of their mouths to prevent reinfection, because we've cured the infection, but if they don't know how to take care of their mouths after that, they can easily get reinfected, because they are going to be exposed to these organisms no matter what. But if they know the proper home care techniques, they will not get reinfected. They'll kill these organisms before they have a chance to start doing their damage.
That answer your question?
Yeah, of course.
Dr. Nemeth, your watch is hitting the table and clicking.
What?
It might be the ring
What?
or something like that. Yeah, sometimes during the
And
show,
his
it's
watch
like,
was hitting the table as he was
Oh, okay.
talking.
Yeah, I gotcha.
there you go. No more watch.
So Mark, what section are we?
The last one.
This is the last segment? Oh, well, we better discuss.
Go hiss. Let's get through this quickly.
No, but,
I got a lot of things I want to talk about.
Yeah, but I think that you really need to think about, right now, you've got like 9 minutes,
No,
right?
8 minutes, really,
Yes,
because
8.
you have a 1 minute outro.
Yeah, okay, so anything that's, dramatic,
Yeah,
finale,
okay, well, tell me when we're ready to go here.
So are we going to pick up with, treatment?
Yeah,
Okay. And then before we start rolling, just remember now that when we get down to 2 minutes and then 1 minute 10, you've only got 10 seconds, because I got a minute to get out. Okay?
yeah.
All right. Ready? Welcome back to this special edition of the Dr. Nemeth Radio Show. I'm your host, Anne-Marie Cronin, here tonight talking with Dr. Nemeth, board-certified periodontist in Southfield, Michigan. Dr. Nemeth is with us discussing his state-of-the-art clinic, latest treatments in periodontic care, and the relationship between gum disease and many systemic diseases, from cardiac issues to cancer. Now, Dr. Nemeth, tell us a little bit about what is the treatment protocol?
Well, in my office, we treat with a laser. We don't cut tissue away anymore like they used to, or they still do, and I used to even a long time ago. We use a laser. The laser goes into these gum pockets. It destroys the bacteria. It tends to shrink the pocket. The pocket then tends to reattach to the tooth, so the pocket is not so deep, so bacteria can't get in so easily, and one can keep it clean much more easily. So we use what's called LANAP, or laser treatment, to treat these patients. Minimally invasive, maximally effective, very little cutting away, and very little negative cosmetic effects compared to the traditional way of treating periodontal disease. But let me talk about recession too, because that's a whole other kind of periodontal disease that we treat totally differently. So when one has gum recession, that means more of the root is exposed, the root can be sensitive, it's unaesthetic, because when you smile and you have these long roots showing, you're long in the tooth. Long in the tooth means you're old. So people don't want to be old, but more importantly, people should not want to lose their gum and their bone, because gum's lost, bone's lost. So we do something called the Pinhole Technique, where we actually loosen the gum tissue below or above the area of recession. We loosen that gum tissue with special instruments, and then we loosen it so much that we can actually bring it down over the roots, and then we put a special material through this small pinhole that we make to thicken the gum and hold it in place. It's, again, there's very little there's minor or very little pain associated with this compared to the traditional way of cutting gum out of your palate and using that to cover the roots. The Pinhole Technique, I would never go back to the other.
So this is a relatively new. It's
relatively new. I was the first periodontist in Michigan certified in the pinhole, and I was the first periodontist in the world certified in the advanced pinhole technique by Dr. John Chow in California. And it's great. It makes a great cosmetic difference. It helps people save their teeth. Teeth become less sensitive, less prone to decay. It's really a wonderful, wonderful technique. We also have people who have what's called a gummy smile. When they smile, too much of their gum tissue shows. They're embarrassed to smile. They put their hand over their mouth when they smile. We change the lives of these people because we actually sculpt that gum tissue. We reshape it so that when they smile, they've got a beautiful smile. They don't have a lot of excess gum tissue showing. Their teeth are a normal length, and for the first time in their lives, they can smile without being embarrassed or uncomfortable about it. One other subject I want to mention, and that's bad breath. We probably have the most well-known bad breath treatment center, I would have to say, in the world. We have people coming from all over the world. We have them coming from Bahrain, Africa, United Kingdom, all over the United States, and of course as well as Michigan, to treat bad breath. And again, bad breath is caused by bacteria. We determine the source of these bacteria. Then we eliminate these bacteria, and then we teach the patients how to prevent them from coming back so they don't have bad breath ever again. To me, it's a miracle cure for bad breath. It's absolutely great. And we have that. That's another service that we provide. And of course, we do dental implants. Implants are very important. There are teeth that can't be saved. There are teeth that are missing. For those teeth, we do dental implants, because if you can't save a tooth, the best thing is a dental implant. It's almost like having your own tooth in your mouth. It goes into the bone like your own tooth. And I have a couple in my mouth, actually, because I have a cyst, nothing related to gum disease. And I don't even know they're there. And they usually last a lifetime. So the dental implants are great.
Now with dental implants, quick question, how long does that take? You take the teeth out and then how long before you've got other teeth in?
Well, sometimes people have to have all of their upper teeth out or all of their lower teeth out. In those cases, we take those teeth out, or they may have no upper or lower teeth. We put 4 or 5 dental implants in the same day, and they walk out with a full set of beautiful, permanent teeth. They walk in with a mouthful of ugly, loose, decayed teeth, or whatever. We take those teeth out, we then put implants in, and we put a permanent bridge in that enables them to walk out of our office proud and happy, able to eat, able to chew, able to smile. Life changing.
It is life altering, but as I'm hearing you, I'm thinking about the fact that you're like an A to Z. You're dealing with the health effects of having proper dental hygiene and taking care of removing all the bacteria that causes all these diseases. But at the same time, I'm hearing that you've got a cosmetic practice as well, and a pain-free office.
We do a great deal of cosmetic work, and whenever I work on a patient, I use IV sedation. The patient goes to sleep, we do what we need to do, the patient wakes up, they're usually very pain-free or minor discomfort, and when a patient says they have a fear of dentistry, I say, don't fear, because you're going to be asleep for whatever we do, you're not even going to know about it, and you'll wake up and everything will be done and completed. So IV sedation is a very important part of what I do. I use it almost all of the time.
Yeah, I think that's one of the things that keeps people from going to see a periodontist probably, is because they're thinking about the old-fashioned way of, I'm going to get my gums cut, it's going to be surgical, I'm going to lose time at work, and there's going to be pain involved. So what I'm hearing from you is that's just not the case.
We don't cut gums to treat periodontal disease or to treat gum recession. We may cut gums if they have a gummy smile, just to reshape and sculpt that gum tissue. But that's one of the few times that we actually do remove gum tissue.
And with the laser and with the pinhole treatment that you're doing, I'm hearing also that you're one of the few places where patients can go to have this treatment done.
Well, as far as I know, that's probably true.
Okay, so I would say that most patients should start off at an early age going to see you, and they shouldn't be waiting until it's too late in the game.
I think most patients should have their mouths checked to see if they have even the beginnings of periodontal disease, because the earlier you treat it, the better it is, particularly when it comes to Alzheimer's, because that can start at a very young age and be initiated when you're very young and you've got these bacteria in your mouth and don't even know about it. But the sooner those people get checked, the sooner we can treat them, and the sooner and the better chance we have of saving their teeth, and that helps save their lives, quite frankly.
That's absolutely true, but I'm thinking in the case of all this recent research with Alzheimer's, that it seems imperative that almost everybody would want to go in and be checked, because these are frightening diseases. These are horrifying, frightening diseases.
It seems that way, but when people don't have pain, many people say, well, my mouth's not bothering me, and they have to be pushed. They have to have pain, or their dentist has to say something's going on, or their gums have to start bleeding and their teeth have to start shifting, because that's just human nature.
Well, I think listening to this show and hearing what you've had to say has been so terribly informative, and I think that everybody should go in and get this, have a checkout done with you.
Well, thank you very much. I hope the word gets out. It's important to me to really make an impact, to help people, because it makes me feel good, but more importantly, it's really important for the patient.
Absolutely. Well, we're out of time, and that wraps it up for the Dr. Nemeth radio show on News Talk 760 WJR, sponsored by the North American Society of Periodontists. I'm your host, Anne-Marie Cronin, and again, I want to thank Dr. Nemeth for talking to us about taking charge of our health, being proactive, and take a look at his practice. Go to YouTube and search Dr. Nemeth to see his videos on all the subjects he's been talking about. For more information on this evening's show, or to learn more about Dr. Nemeth's periodontal practice, you can reach him directly at 248-357-3100. That's 248-357-3100, or by visiting him on the web at drnemeth.com. Again, that's drnemeth.com. We hope you enjoyed this special show and that you become more informed about periodontal disease, its impact on our overall health, and what we can do to halt or reverse the process. Thank you for listening, and good night. Good?
Good?
Yay, sounds really good. Also, that's a
Sound
good
good?
idea.
What?
Sponsored by, yeah.
Well, that makes it very impressive, I think.
You want to say goodbye to your YouTube subs, Dr. Nemeth?
YouTube what?
Subscribers, they're all waiting here for you.
Oh, there we go.
Yeah, don't forget to subscribe to the channel, right?
Hey guys, again, it's me, Dr. Nemeth, Periodontal, Southfield, Michigan. I just did a radio interview with Anne Marie, and I hope lots of people hear it because it'll benefit a lot of people. And if you are a YouTube subscriber, I am glad. And if you're not, subscribe to my YouTube channel and make sure your mouth is healthy because you will be healthier. Have a great day.
Yeah.